We've heard about acupuncture. I mean, it's ancient Asian type of healing that people have used for thousands of years. And how well does it work? Well, a lot of people say it works great. Well, there's actually something else called dry needling. And that's what physical therapists use for a whole bunch of different things. Well, we brought in a couple of young ladies from the Community Rehab Physical Therapy Center here on the Gulf Coast. Stephanie Hawthorne, who is the office manager and a physical therapy tech, and also Katie Fulgham, who is one of the physical therapists there. Welcome to the show.
Thank you. Thanks.
I have never heard of dry needling. I've heard of course, acupuncture, and you see, people use it all the time. And but dry needling. Tell us, what is dry needling?
Well, dry needling is a tool that physical therapists can use to help reduce muscle pain. We stick acupuncture needles, so that's why a lot of patients get that confused with acupuncture, into muscle tendons, along the muscle trigger points, along neural structures, and also in connective tissue to help reduce pain.
Now, is it the same as acupuncture?
It is not the same as acupuncture. Dry needling is a Western-based medicine. Acupuncture is Eastern-based, Chinese.
Right.
They use a lot of meridian points along the body. We use the anatomy of the body. If you have pain in a certain spot, like a trigger point, we'll stick a needle in there to help reduce the pain and release the muscle trigger point.
There's a routine, I don't know if you're familiar with the comedian Bill Engvall, that he does, that he went into an acupuncturist and they filled him full of these things, and then they put lighted stuff on him, or cotton balls, and lit him, and then left him alone. So I'm sure that's not what...
No, not at all what we do.
That dry needling is all about. How exactly does it work?
It works by when you have a tight muscle, basically the muscle is lacking blood flow or oxygen. When you have that tight muscle, it's painful, and that lack of oxygen is causing pain, and the pain may radiate to different parts of the body. When you insert a needle into the muscle, it brings blood flow to the muscle and helps relax that muscle trigger point. So by that blood flow, it can help heal the muscle, and you can put it on a tendon also too if you have tendinitis. It can help heal the tendinitis quicker, bring all those cell mediators to help reduce pain and also induce healing.
So basically, it works fairly quickly?
It does. It does work very, very quickly. You can see results within, usually you're very sore after treatment, just like any kind of shot or trigger point injection.
But you're sore anyway.
But you're sore anyway.
If you've got sore muscles, you're sore anyway.
Usually takes about 24 hours to notice a difference. But after a couple treatments, I usually recommend about 2 times a week for 3 or 4 weeks. You can notice a big difference in the muscle belly itself. It can release and just kind of stay relaxed for a while. So
it helps relieve the pressure, and it helps the blood flow better to these areas.
Exactly.
I mean, because I'll admit right now, I've got from going to the gym, I've got a pulled muscle back in here that's just giving me fits. I've got a lidocaine patch on it right now, and had I known they were going to do this, it's like, bring a table, put me on the table, and do this. But Stephanie actually has an issue in her shoulder, her left shoulder, and you're going to actually demonstrate?
I'll demonstrate kind of what that would look like. She's a runner, so a lot of runners and people who are either at a computer desk all day or maybe had a whiplash injury or something have upper trap knots that are common. So I'm going to kind of demonstrate what a needle placement into that knot looks like.
Okay.
So I'm going to do that on camera.
Well, go ahead and do that, and while you're getting set up for that, I want to just mention some of the different things that cervicogenic headaches, TMJ, which has to do with the jaws, whiplash injury, shoulder pain, bursitis, carpal tunnel, muscle strains, plantar fasciitis, Achilles tendonitis, scar tissue adhesion. So you're going to show on there now exactly how it's done.
I usually kind of palpate around the area. I might clean the area off if it's got lotion or any kind of
which she did beforehand.
Which I did beforehand. Then I'll place the needle kind of where their pain is and where the knot is, insert the needle quickly. Sometimes I'll manipulate the needle, but just kind of move it around to see if we got the right trigger point or not. and then take it out. Usually there's no blood at all.
Oh, so you don't leave it in there?
I don't. Well, for certain areas we do.
Okay.
For the low back I would. For the upper trap I wouldn't, since it's kind of a sore spot for some patients.
Okay,
But
so if you
usually
did my
I'd
lower
have-
back, I'd be walking here, right out here like a pincushion for a little while.
Usually I'd have people lay on their stomach,
Mm-hmm.
just in case, just to be relaxed and safe.
Right.
And then I'd leave the needles in for about 10 or 15 minutes, leave
Okay.
the room, come back and take them out. That's shown better results.
Yeah, if
in-
you lay me
in
down, I'm going to be
studies.
asleep like that. So that was it?
That was it. Then I'll discard the needle into this sharps container.
Mm-hmm.
And then she should be good to go. She'll probably have a lot of other trigger points I'd work on besides that just one, but that's just kind of a demonstration of what that would look like.
How'd it feel?
Fine.
Fine. No, just, okay. And like it helps loosen up in the muscle and bring some blood flow to it.
Some patients might feel like a little twitch response of the muscle. They'll feel some warmth or sometimes radiating pain from the needle inside. So it's not always a comfortable treatment. They'll feel a little sore afterwards, but we usually finish it with some heat and something to make them feel better afterwards.
Well, what can you do after the treatment?
After the treatment, the best way to use dry needling is in conjunction with physical therapy, doing exercise with it, because she may have a tight muscle that she needs to stretch,
Right.
or she may have some postural problems she needs to strengthen. So I'll usually do all those things first and then dry needle her afterwards, since it is trauma to the muscle.
Right.
And then I would put some heat on her, maybe massage her afterwards so that she's not so sore going home.
Okay, let me ask you this. I mean, as physical therapist, I've heard of the foam roller things.
Mm-hmm.
Are those, like for my back and all, is that something that's good for the back?
That would be something good for the back. That also brings blood flow, not as effective as the needles, but
Right.
we put a foam roller right around the area of pain, and you can roll around on it.
tennis ball.
Tennis ball as well, just like a deep massage does, will bring blood flow to that area.
Yeah, I could use a deep massage for that right now, and the acupuncture thing. Now, if somebody's interested in finding out more about this, and this is something that y'all do, do they need to go through their doctor and get a referral to?
Usually they do. If they have any kind of neck or back pain or have any pains at all, they need a referral from the doctor to be covered by insurance, and then they give us a call and we'll see if they're appropriate for this modality.
Oh, so the insurance can pay for this?
We usually have an extra fee on top of insurance.
Okay.
Some insurances don't take it, so we have a $5 fee if you want dry needling as well.
That's
Each
it, $5?
visit. Yep, each visit.
Wow.
Yep.
Because you go to acupuncturist, it's going to be more than
Exactly.
that. And again, I've never heard of a physical therapist using this.
Yep, it's kind of a new thing.
And that's
So-
that's really interesting. Well, if you want some more information about dry needling and community rehab physical therapy, located here on the Gulf Coast, phone number's on your screen. The web address is on your screen as well. If you'd like to find out some more about them, give them a call. If you want to set up an appointment, of course, as she said, you have to go through your doctor and get a recommendation at first. Thank you so much.
Thanks.
Thanks for
Thank
getting
you.
stuck over there. I'm next. Anyway, again, give them the call. Community Physical Rehab.